The state's health insurance exchange, known as Covered California, wants to enroll 500,000 uninsured people by February 15th. More than 3 million of the state's residents do not have health care insurance. Jan Spenceley is executive director with the nonprofit San Diegans for Healthcare Coverage. She joins me now. Jan, consumers are expected to see changes in their health insurance plans under the Affordable Care Act. What are some of those changes expected next year?
I think, well, actually in California, we've been protected from many of the variations, and because we have our own exchange. So the biggest changes will be that some of the health plan premiums went up, some went down, but by and large, all of their benefits stayed the same. And that's a good thing. There are not going to be any big surprises for people in California. The federal exchange, some states, there are big surprises for people.
Okay, so I just want to reiterate some deadlines that are coming up. December 15th is the deadline to enroll in Covered California for coverage to begin in January.
Yes.
And then open enrollment for Medicare is, the deadline for that is Sunday?
For Medicare, oh yes, for Medicare, the open enrollment deadline is this Sunday, December 7th.
Right, and then the goal is to enroll 500,000 people into Covered California by February 15th. What's being done to reach the uninsured?
Well, I think the big thing that we have to do is overcome what we know are some of the barriers, and two of them are that some people didn't even check last year. They just assumed, the studies show us this, they just assumed it was unaffordable. And so our message to those people is if you don't ask, you don't know. Don't make assumptions. Everybody needs coverage, and there are many affordability programs now for them.
Well, let's talk about that, because I know that there are low-income people who qualify to join Covered California, but they still can't afford it. So what's offered to help them?
Well, actually, there's premium assistance, and these are tax credits if they are low income, and it's based upon your taxable income, basically. And so it's as low as $26 a month. You can't get really much lower than that. And if your income is low enough as a family, you know, it's based on family size and income, you're eligible for no-cost Medi-Cal. So that's free coverage. So I think that people don't know, if they don't check, and we've learned 2/3 of those that did not enroll last year of the uninsured didn't even check. And so what we're saying to people, come on, at least that's what we're here for. We're here to help you, and we'll help you figure out what is affordable for you.
Now, some other people who didn't enroll last year are people who may have undocumented immigrants in their family. They've been reluctant to join. Are there efforts to reach out to them?
Yes. In fact, our community, I think, is doing a great deal. The organizations in our community are putting a lot of messaging out to immigrant families. San Diego and California as a whole are home to many mixed immigration status families, not just undocumented persons, but people who are waiting for their immigration status to change, waiting for their citizenship. And so those people are worried. And all the studies tell us they're worried. So what we want them to know is applying for coverage, your information is secure. It will be used only for coverage. It will never be shared with any other government agency. Applying for insurance will not hurt anybody. In fact, if you do in fact have undocumented persons in your family, you don't need to worry about that. It will not hurt your sponsor. Many people are very worried that applying for coverage will hurt their sponsor, the person who sponsored them to come to this country. It will not. And we have those assurances from the federal government. So I think it's important for people to know that and to understand they shouldn't fear that. They can get coverage for themselves and their family.
So is California Covered doing a better job than it did last year in enrolling people?
I think that we are all doing a better job this year. It just started. Open enrollment just started. We're pretty busy. The community's pretty busy. The systems are better. We understand them better. So I think that and we understand the rules better. Remember, we started last year with not knowing all the rules. This year we know the rules better.
And so what kind of help is available? What's out there?
Well, first of all, I want to tell people, we prefer that you come to us for assistance, that you come early and you don't wait for the deadline, because then we'll all be full and maybe the systems will be overwhelmed. But come get help. There is assistance. You can go to the Covered California website. That website has several places where you can find help. And there are certified enrollment counselors, like my organization has them, and many organizations in the community do. And there are insurance agents. and they are certified. All of them are certified by Covered California to provide assistance. Another way, and I do say this, if you think you can maybe do it over the phone, call 211 San Diego, and they will provide you information, and they may even provide enrollment assistance over the phone.
Jan Spenceley, thank you so much. We've got more information on our website as well as links.
Thank you.